Hi, Vanessa. You and I met in South Africa in 2018 when we were CDC Global Health Fellows. Before, during, and after that time, you've built a career at the intersection of global health data, consulting, and capacity building, moving from research and program evaluation in Rwanda and South Africa to data strategy for USAID and CDC, and now leading your own firm, Chilombo Consulting, where you advise diverse organizations on data storytelling, visualization, and decision making. I've been really impressed to see your journey of independence unfold. Alongside this, you've supported maternal and child health initiatives, HIV programs, and DEIA focused projects, always centering the importance of high quality, usable data. I'd love to hear more today about how you translate complex data into meaningful narratives that influence policy and practice in global health.
Sounds good.
So, first question for you, getting started in data and global health. You began your career working on research projects and later supported HIV and maternal child health data initiatives before founding Chilombo Consulting. What experiences convinced you that data storytelling, not just analysis, was essential for impact in global health?
Yes, great question. And I think I'll actually kind of just came to mind. I'll start kind of a little bit earlier in the process. So, kind of before I even really knew that I wanted to go into data specifically in the public health space. So, while I was an undergraduate at UNC, I was fundraising chair supporting an organization called Foundation for International Medical Relief of Children, or FIMRC. So, chapters at different universities where students who are interested in health, public health, global health could support different organizations that support child health around the world. And so we were specifically supporting a clinic in Costa Rica, helping fund them, provide supplies, and also through that, learning more about the context of primary care and general health issues for children in that area. And so, in fundraising, not an area that I'm in a lot right now, a little bit, I guess, through some work I do on a nonprofit board, but a lot of it is like being able to communicate what is actually happening, telling the story of the programs in order to raise funds so people can resonate with what's going on and also feel like their money is contributing to something meaningful. So I think that was the first time where I was actively doing work that was like, okay, figuring out how we can best communicate, why we're fundraising, what we're using this money for, and all of that without actually knowing the concept of data storytelling as we see it today, in all of the literature, all of the services, all of kind of like the global health or public health work. And so now, kind of being in global health, and I think the role that I really delved into, not just being as very hands-on and building the analyses and kind of like handing that over to other people who are maybe more so developing the communications, but while I was at USAID working in their Office of HIV/AIDS, really being able to always making sure that I understood the story that needs to be told before even starting the analysis. And I think that skill is so important because it's really great to be able to delve into the numbers or the qualitative data, the stories, but if you don't know how to communicate it, then you're not bridging the gap between like, this is a finding versus how this finding is going to help us make a decision about this health program, or how this finding is going to help us make an impact or recommend a change or an improvement. And so, I think data storytelling also allowed me to think of it as someone who, my MPH was in, my master's of public health was in global epidemiology, very quantitative or numbers focused, but I was the global health part of that global epidemiology degree allowed me to focus on the qualitative work. So data storytelling, sometimes we think of just the numbers, when people hear data, they often think of numbers, but it's really making sure that those numbers and the, qualitative narratives are bridged to bring together a story. So you're not just saying these are the findings, this is why you should do this, but you're setting the scene, you're building the like the story arc, essentially the narrative around it. You're showing an example, you're making sure that people are interacting with the data or have contributed to the data so that they, especially if you're sharing information to the communities that the data is about, that they've been part of the process, they were part of the story, and it feels like it's their story as well. So data storytelling can mean a lot of different things, but I think those experiences, especially at USAID, where I had to really be able to communicate the analyses, do the presentations, in all of the data, be able to take it in a very streamlined, short time. Sometimes you don't have long to really communicate the point. That skill is really important, and it's also not just like a hard skill of like being able to analyze data, but also like the soft skills of being able to communicate it and have discussions around the data as well.
Yeah, thank you. You touched on so many things. I liked especially how you started with how this can inform or advocate for or get funding and be used for fundraising. I think that's so important in the way that the global health world is shifting right now, and how important donors are or alternative sources of funding as the traditional sources of funding have changed. So
Mm-hmm.
that's really interesting. And everything else you said is like a great segue to our next question about making data meaningful for decision makers. So thank you. And in your work with USAID, CDC, and now as a consultant, you've often had to bridge the gap between technical data and policy action. Could you share an example where translating numbers into a compelling story helped shift a specific decision or priority in a health program?
Yes. So I can speak to maybe work while we were both at CDC South Africa. So one of our big initiatives was really, it was called Project Patuma or Project Cienza, and it was really around increasing the number of people who are on treatment for HIV. There was very low rates of people who are on treatment who are diagnosed, and they realized that they needed to be a bit more support in terms of supporting the health facilities and our partners in that initiative. And so my role was really as a data manager and analyst. So all the data coming from our different facilities, being able to analyze that, help communicate it to our different project team members who are working hands-on with the health facilities on different QI or quality improvement projects. So kind of like small little initiatives they were doing to be able to kind of move the needle on treatment. So essentially many projects thinking of new innovative ways that they can ensure that the population of South Africa who was diagnosed with HIV got treatment, and also those who weren't diagnosed but had access to testing and all of that. And so being able to, I would say there's kind of many different ways this was done, but the way in which I was most involved was kind of through these weekly presentations to really share out the findings, communicate what was there. But of course, we had all of our staff who were hands-on the facilities. They had more of the narratives as what was going on directly on the ground. And so it was kind of a team effort of combining both the quantitative data, how we saw the numbers fluctuating across the different HIV indicators, as well as through what was happening in the context of the different communities, different districts of South Africa, and what that really meant for the program. And so by being able to kind of have that very frequent data coming in alongside, the site visits and the context around the health facilities, they were able to really respond to, okay, what's working well, what isn't. We started, for example, same day initiation or starting treatment the same day you're diagnosed in these certain communities. And this is the messaging. Okay, this seems to be working or not. How can we pivot? So just by being able to like have that role, really making sure the data was communicated and the key points of the findings were shared and through our tool, our dashboard, and then working with the technical teams who are working on site, of course, with the clinicians and the providers to actually translate that into the activities that help move forward in increasing the number of South Africans who are on HIV treatment in the target facilities. So I would say kind of that was one that was very kind of hands-on involved because, as you know, it was a huge undertaking and a lot of people involved in making sure that the work was tailored to the specific facilities that were receiving this program and the support from USAID South Africa at the time.
Okay, I'm hearing you talk a lot about tailoring.
Mm-hmm.
So I want to get into that. That's for the next question. But I was wondering if you could just say a tiny bit more about like what is this data? Because I feel like for people who might not be familiar with global health,
Mm-hmm.
like data is a big word, but what could you just give a couple examples of what data points you actually might have
Mm-hmm.
been used?
Yes. So it's really different data points. And in my case, I was working with the quantitative data, so the numbers of HIV indicators. So things like the number of people who tested positive for HIV, and then the percent who were positive of those who were tested, right? So sometimes it's a number, sometimes it was a percent. Also, then looking at the number of those who tested positive who was linked to care. I mentioned same day initiation. So that would be people who were put on treatment that same day, which, is one of the major goals, but also looking at 7-day initiation was popular in that context too. So within 7 days for individuals able to be linked to care, and get onto their treatment, their antiretroviral treatment. And then also from there, looking at retention. So how long were people in care? Were they coming back for, their appointments? Were they able to continue taking their medications? And then further down the line, although in that immediate kind of period, we weren't looking at viral load suppression, that was something that was integrated later on into this specific, although it was an indicator they were looking at quarterly across all of the facilities for the specific project that I was monitoring. It was integrated later to also look at, again, the long-term effects of this. Are people not just getting on treatment once, but then dropping out? Are people staying in treatment and then their viral load being suppressed, which allows them to no longer be able to transfer HIV to another individual? So those are some of the key metrics. They're kind of some of the key, what they call in like the HIV cascade or care continuum of indicators that were tracked quantitatively. And there were, of course, different, we looked at this by district, by province, by activity, by all these different areas. But those are the key ones that were looked at for this specific project. And then they were built upon, expanded. I think by the time that I left, there were maybe 15 metrics that they were looking at least weekly to monthly, across tracking HIV treatment, care in the population.
Okay, great. When I was listening to you, I was thinking for people who aren't who are still students in public health or who are learning about global health, I don't want y'all listeners out there to think that this is just relevant for HIV because these same metrics could be relevant for pretty much any health issue. I mean, think
Mm-hmm.
about non-communicable diseases, think about like diabetes care in the US. This is not specific to South Africa HIV. We always want to know for any health issue. Are people getting tested? How do they know about their diagnosis? Are they getting on treatment?
Mm-hmm.
How long does it take for them to get on treatment and get their health condition stable? So we can learn a lot from these same metrics and apply them in our work as future professionals in global health. But talking about
Mm-hmm.
context, that's back to our next question about your experience with the South African context and others. So you've worked in diverse settings, South Africa, Ghana, Rwanda, and across US-based agencies. So what have you learned about adapting dashboards, indicators, or visualization tools so they resonate with stakeholders from very different cultural, institutional, and resource contexts?
Yes. So this is a great question. And even in, the countries that you mentioned, the needs are all different based on specifically, what their programs are focused on. So for example, when I worked with Rwanda at USAID, they did a lot of work with the Dreams program, which is a young girls and adolescents program. And so, they tended to follow and track more metrics around young girls and adolescents on HIV. My work in Ghana was mostly on the maternal and child health side, so thinking of a whole other set of metrics. But even though I was, more hands-on in Ghana, I looked at those metrics across other countries, and there are certain ones that were more relevant to others based on if there was a high rate or something of that specific issue. Then okay, we definitely need to track these versus it's not an issue here, we don't need to track it. So one thing in adapting is you want to make sure the metrics are relevant, right? I mentioned some of the key HIV metrics, but there's so many other layers and things that you could collect, but really it might not be relevant to every country or every stakeholder, right? Sometimes your dashboard has to go to multiple stakeholders. So having certain views or pages, like, sometimes it's like you have the executive summary page, which your high level leader who just needs an overview is looking at, versus something more detailed where your partners are delving in and they're able to filter to their specific city or community to see what's going on. That's actually something that I have in a dashboard for a project that we're working on here at Chilombo Consulting, where we manage a dashboard for US-based health initiative, where there are different partners from different states with different clinics and different contexts. And so there's also the funder who looks at it, and they kind of care about these metrics, while the others care about looking at those same metrics, but in a more detailed way. So part of it is what metrics you include, the level of filtering, which means, am I looking at everything, or am I looking at a specific partner, or am I looking at a specific city? And also just sometimes how it's visualized. Sometimes seeing a chart with the clear bars is most helpful, especially if a leader wants to just take that and send it to someone and have that clear indication. Or sometimes, having it in more of like a table format, where you might have high percents colored one way, low percents colored another, is more intuitive. So in order to know all this, right, not a guessing game, it's liaising with your stakeholder, having those touch bases, those communications as you're building the tools. Because oftentimes the person building the tool is not hands-on in the program. And so you have to have that, cross communication in order to ensure that you're getting a tool that is relevant and the right, resource as well. And then like kind of speaking to culture as well. For example, this population I mentioned, this dashboard that we manage, there are clinics in some predominantly Hispanic areas, predominantly Black areas. And so also how you are naming your, like if you're looking at certain demographics like race and ethnicity, and there are different preferences around grouping and reporting. So making sure that, especially in this case where you have to standardize certain metrics across different reporting types, making sure that you have a consensus on how it's being reported and a clear code book that shows, okay, it might be showing up as Hispanic or Latino here, but this is inclusive of these groups for the purposes of this reporting. Because sometimes you do have to make those compromises, both for confidentiality and for just kind of a streamlined tool, but you want to make sure that the different context is not getting too lost in your messaging, which is why when you do have that quantitative dashboard, it's always important to have the qualitative context to accompany it when you're communicating around the results, just so that doesn't get lost. So just some things to think about next time you see a dashboard. I recommend, if you're curious, go to public Tableau. You can Google public Tableau dashboards, and people who have dashboards that are publicly accessible. You can see all types of dashboards. I have, some on there. And it's also great for inspiration if you're ever tasked with building a dashboard and you're like, how can I do this? You can see them in every sector. Health, across every topic, there's a dashboard in that public platform for you. And Tableau is just one data visualization tool for dashboards. There's many others out there, but just, that's a bit about just, integrating and adapting tools, specifically dashboards and visualizations for different contexts.
Thank you. I just looked that up now, and I'm going to link it in the video or next to the video.
Awesome.
I think it's really great, especially for students, to look at examples. Recently in this global health course, I asked students to make infographics, and realized I should have shared a lot more examples in advance, because it really helps to see kind of what's the norm, and all these tools can produce all different things. So yeah, Tableau is a great one though.
Yes, infographics are also great. Having that static one pager, that's also another tool service that we've provided for clients before. And we've also made internally for our business an infographic to show, what we've done in a given year as a way to promote our services. So many great ways to use infographics in consulting and public health, just across the board.
Yeah, and these things have different, like a dashboard to show data has a different goal than an infographic. I mean, of course, we're showing data in different ways, but something I tried to stress to the students is These are not meant to be text heavy. That might be a
Yeah.
policy memo or something else. These are meant to
Hmm.
enhance those visualizations to get messages across. Yeah, we
Exactly.
can go down that rabbit hole, but moving on. I mean, you just talked about leadership, like speaking to leaders or speaking to people who are hiring you or who are, asking for these visualizations. But what
Hmm.
about the people who the data is about? So this question's about
Hmm.
equity in data use. Many of your projects touch on important and sensitive issues like HIV, women's health, immigrant health. How do you ensure that marginalized groups or people who are vulnerable in some way are not only represented in the data, but that the data is used to improve equity and health outcomes? Something we always have to remember.
Yes, this is so important. And it's something that I think of even at the point of, we are, there's an opportunity to say evaluate a program and we have to, write and submit what are our methods for going about it. And one thing we always include is making sure that we're incorporating, the participant, the client, the community in the process and whatever step that is. So like an evaluation, we call it participatory evaluation. So you're actually engaging with the people. And so what that means is making sure that it's not just a matter of, hey, here's this survey for you to do because we're trying to understand what your experience is as an immigrant in health, but actually making sure that you're piloting questions with them, or you're providing a forum where we have the preliminary data. How do you feel about this? Does this represent, how we're planning to present it? And making sure that, and part of that is even in the research team itself being diverse and having that representation, on the team. For us, we're very much at the point of, like, say in the consulting space, we apply to things where we have experience, but sometimes that is lived experience. For my team, that might be, we have lived experiences, like
Mm-hmm.
living in other places, being immigrants from other countries, being a part of that subpopulation that is being evaluated. And so that is also important, the lived experience of the research team and those who you're directly engaging in, but finding the balance between not extracting too much, providing compensation as well for participation, and making sure one of our clients that we worked with does this very well. And they're called Multicultural AIDS Coalition. We worked with them for a few projects in the past, and they do a really good job of integrating the community in all stages of their project through different stages of things we developed. Like, okay, this is where we are with the data story presentation. We're going to take it back to our community partners, have them look at it, provide feedback. So it's not just them as the researcher who is like providing the feedback on the work, but also them taking it back to the community to do so. So those are all good practices. And I think one thing that I always like to push back on is sometimes, and I'm guilty of this myself, is you have a timeline and you haven't integrated this extra time you need to get that feedback, but ultimately knowing that the goal is to it should be inclusive, it should be equitable, and so building in that time to really not just be, I'm doing this one review, we're done, but making sure that you're integrating it and it's an iterative process. And I think one thing that is changing a little bit more, especially when you start looking at like not just programmatic work, but research, is making sure that it's accessible, it's not behind a paywall, that there's that information could be seen by anybody. Of course, there's a confidentiality, so making sure that it's shared in a way that isn't giving away people's identities who don't want their identities given away, but that it's accessible. And that is also sometimes when research happens and you take a survey or a part of a study, and then you're like, all right, unless you're someone very connected in the research community, you might not be able to find where the results of this thing came, but it should be clearly shared back, and not just, again, as like a lengthy texty report, but as an infographic, as a presentation or something where, like, hopefully you already know the progress because you were engaged, but if not, you at least get to see the end result and all of that. So there are many different stages and ways to do this. This is actually, there's a project that my team and I have worked on in creating like a framework around this. that is really essentially like an equitable approach to analysis and evaluation. And so that is really something that I'm passionate about.
I agree with everything you said, and I'll just I'll just share that I honestly don't think I learned that in public health school or in my public health early experience. I didn't learn that.
Agreed.
It wasn't impressed upon me how important that was, like as an ethical obligation to share back the results or the findings of research that people participated in back to them until I started doing my PhD in anthropology. And those ideas are more grounded, I think, in that field because of its history, I'm not sure why, but that is something that needs to be brought more to the forefront of public health. So I'm glad you shared that, and I hope the students listening remember that too, that we have an obligation to the people who are involved in research or who it's about.
Yeah, community engaged research. That's a very common phrase used
Mm,
and something that I encourage students to look into
mm,
because I think that um, it's now again increasing. I think with some of the focus around more equity in work and what does that mean. But I think putting an action is sometimes challenging based on the context of research or program or work environments where there's timelines, there's kind
mm.
of roles and structure. And so a lot of times it does mean kind of pushing the boundary, pushing the needle on what might be commonplace to really advocate for those that you are hoping to help through the health programs or health research that you're doing. So it's important, and sometimes it's just a concept and it's not implemented.
Mm,
And so that has also been kind of something that, with my work in consulting, where, within it, like you're not, especially as data consultants, right? You can be a degree or two away from what is directly happening in the community, but there's still
mm.
things that you can do in terms of the data itself, right? As I mentioned before, that can contribute to equity in data use. So yeah.
Yeah, that's great. And I'm gonna shift to a question that's not as exciting, but maybe as important. Um, this is about these skills for future professionals. You mentioned a lot of things about technical skills, which is fabulous and critical. What about soft skills like communication, partnership building, leadership? What do you believe are most critical for public health professionals working in data, besides the technical skills you already mentioned?
hmm Yeah, so all of the ones you mentioned, but I'll say, um, really one thing that I think is so important in data is active listening because
Mm,
you are in a position oftentimes, say you are like the data manager on the team or you're the data analyst on the team, right? And you're working for a health program. Oftentimes, especially if you're kind of earlier career, you might not have the subject matter expertise, right? Like when I started my career, I guess HIV was one of the first health topics I was in, as well as kind of family planning, maternal child health. So in the beginning, like I had data skills more than I had the subject matter expertise, but I was still even building those data skills. So you really, you're not always in the room where the technical subject matter, conversations are happening. So really active listening to understand what is the goal, what is the purpose, and from that active listening, also being strategic in the questions you ask. I think the thing I like most about like building data tools now, like I still build them, the dashboards and all that, although with consulting, I delegate a lot, but I'm really involved in the strategy and the advising. And so if you have the strategy to build it, even if you don't have every skill to create the specific calculation or code you need to build it, but you understand conceptually the purpose, the objective of the dashboard so that it's going to be the most useful tool, that is really important. So, I always recommend like, if you're trying to build your skill set in data, like, yes, you need to do the data trainings, take the Tableau, Power BI. I'm just listing a bunch of software. But one course that I recommend to everyone is like, take that data storytelling class. Take, like, really pay attention to kind of opportunities to develop and design the tools and thinking through like, okay, what are the important questions to ask? What should I be listening for, paying attention to? Because as you like, you might not always have the subject matter expertise. For example, we've been hired to be on projects that aren't public health specific or in our areas, exact areas of expertise, but because we have the data strategy, advising design, we're able to leverage that to be successful with the team that does have that specific expertise. So that can help you both within global health and beyond to really kind of take your skill set to be able to ask the right questions so that you're not just building something to build something, but you truly understand the purpose of it. And that also not only helps keep you on track, but it helps keep whoever you're working with on track. Because sometimes it can be overwhelming to even like when someone's like, okay, I need a dashboard, but it's hard for them to conceptualize it. You're coming in as an expert who can take all the different ideas and metrics and everything and map it and put it together and develop a tool that is useful for them. So I'd say that active listening and then like the strategic of asking the right questions in the context of data, I think those are some very important skills in terms of just kind of like the data world, but not even just if for those who are not interested in data but want to be in public health. Active listening and asking those strategic questions as well is so important because that also allows you to get diverse perspectives on the work that you're doing.
Yes, and I'm also hearing like a meta level of critical thinking. Like, don't just
Yes,
take what you get and repeat it. Think about it. What else do you need to ask? What's the underlying story here? That's all great. And now we have just one last question. And this is about consulting as a career path. And we could have done the whole interview about this. And I personally am super interested in hearing like so much from you. But in the context of this as a global health education and introduction to students and learners about it, I just have this last question for you. Like you have founded and grown a consulting firm that partners with organizations across sectors. What advice would you give to students interested not only in consulting the field, but also just creating their own path outside of traditional public health institutions? This is very relevant to today.
Yes. Yes. I love talking about consulting because for me, it was a journey. I kind of started in one space and pivoted to what is my firm now, Chilombo Consulting. And so I think one of the most common things is, and this is like advice that I share in every forum that I get the chance, is start thinking about your niche, right? If you're a student now, you might not know exactly what you want to focus on. I didn't know as an undergrad specifically. But what do you like about public health specifically? What is your, and this is a common phrase, your zone of genius. So for me, a lot of us could do a little bit of everything, especially, you take all these core classes, you learn a lot about everything, but my zone of genius is not only what I'm good at, but it's what I enjoy doing. There's things I'm good at that I'm like, I don't want to spend as much time on this. So maybe I won't offer this as a service, or it's complementary to what I do. So like for me is with my growing consulting firm, I have lead consultants who focus on different areas, right? And so you can kind of think about that. Like I focus on data. There's some people that I know who focus specifically on strategic planning. They love developing strategic plans. We've subcontracted for those who need a data component to that, right? But focusing on like developing a strategic plan is not my zone of genius or what I want to focus on. And all of these things you'll learn as you delve into, public health more. But it's really just thinking through your niche. And from there, networking, joining communities. A huge part of my success and most of the clients I've had have been through referrals, people knowing who I am, my business, what we do, what we offer. And so once you're able to develop that niche, get that foundation going, don't be afraid to put yourself out there. That's how people will know what you're good at, what you're doing, and finding the opportunities to do those things, right? I know obviously the job market is tough, but whether it's volunteering for a nonprofit or being able to do an internship or a work study that's focused on something, and you see an opportunity like, oh, there's a social media page and I'm thinking of going into communications. Let me see if I can support with some of the social media work. Sometimes it's being proactive around like finding where there's an opportunity for you to explore an interest. That's something that I was able to do at USAID. And that's how I was able to work on DEI projects eventually as a consultant, because I was really interested in leading a committee within our DEI group at USAID and being able to move the needle forward with work there. And that really helped me be able to do that work in the context that I've been able to do it as a consultant as well as one of our non-public health specific but related areas of services that we provide in terms of like data assessments and everything like that. So all that to say is, there's kind of many different ways, but start thinking about your niche, join there's various public health communities out there, whether it's consulting or research or whatever it may be, and connect with other people who are both where you are, but also ahead of you in the journey so that you can learn. And of course, resources like this, there's so many amazing public health podcasts out there and people who share their journeys and their how-tos. So connecting with people is definitely one of my biggest recommendations as well.
That is awesome. There's so much value there. I mean, you talked about networking, you talked about mentorship, you talked about like connecting with people across experiences. It's also good. I hope the people listening take this to heart, learn from your experience, look you up on LinkedIn, all of the cool things you offer. I've seen like when you did internships and different like kinds of information like you provided online, like webinars and series. So I hope that people interested like look you up and learn more. And yeah, thank you so much for all this wisdom and for your time, Vanessa.
Sounds good. Thanks so much.
Thank you.